At any time, something can seem different inside us. It can be just a sense of not feeling normal.
She was no longer reasoning well, thinking properly, way of dressing, dancing, shouting. I was not happy at mind. I was very sick at mind. Think to have a nice daughter sick, that made me to be very sad at heart.
Sierra Leone is one of the poorest countries in the world, according to the United Nations. It's here where most people grow up struggling every day to survive.
You go to bed stressed, thinking, how are my family going to eat tomorrow? So you have a whole lot of stress, a whole lot of depression, because you actually want to feed your family, but you do not have the means to do it because the economic situation is very, very deplorable.
Since the end of the conflict in 2002, governments have been trying to rebuild the country with the help of international partners. But there are invisible injuries and psychological traumas still waiting for help. Healthcare professionals have noticed that the number of people with mental disorders has increased sharply after the war. However, the national mental health system is still almost the same. The only psychiatric hospital in the whole country is in the capital, Freetown. Koinadugu and Bombali are the two largest districts in the north of the country. They were badly affected by the war.
You find out that a lot of youths having a lot of mental problems because of their exposition to the war.
In 2008, 5 partners of the Catholic Diocese of Makeni implemented a mental health program.
When CAFOD came into the picture, CAFOD helped us to structure and organize it in a more systematic manner, a systematic, structured response to addressing the colossal problem, the great problem of mental health in the country.
Healthcare professionals are one of the targets of the program. At the beginning of the project, they didn't know how to identify patients suffering from mental illnesses.
I just said, go home. I didn't help you. I couldn't because I don't have the knowledge about psychiatric patients or mental health patients.
The Fatima Institute has since been providing a 10-week training course for health professionals.
That means how to be able to identify people with mental problems. Now, we are also providing counseling. Counseling, it just means a therapeutic relationship. That is, therapeutic communication skills.
John Kanu is one of the 30 health workers who attended the first training course. They have been working in the primary health care units in the region.
Now, I have the knowledge, so I'm able to mingle with those people.
Complex cases are referred to the counseling center based in the Holy Spirit Hospital in Makeni. Group therapy involving patients and their families is provided every week, as well as individual counseling. Alex Kamara had treatments based on medication and counseling sessions.
He was a very serious drug addict. He was very aggressive. The illness just started.
1 year later, he could be reintegrated into the community. Alex got a job in the center and is enjoying his new life.
I've discovered new things, I've met with good friends, and that is good.
The program doesn't have the financial resources to employ more staff, but people in the communities have joined as volunteers. Saidu Sise is a subsistence farmer trained by the Justice, Peace and Human Rights Commission. He is part of a group of 21 volunteers from the surrounding villages. While visiting families, he identifies mental illness cases to be treated through the program.
I felt spiritually good, very good, for me being a volunteer to help family.
Like a seed, the mental health program is growing and changing people's lives. From the beginning in 2008 until December 2009, almost 250 patients have been successfully treated.
Most of them have been reintegrated back into their communities, and the level of acceptance by the community, by the neighborhood, by the environment is just so marvelous.
I feel good. I'm glad.